with trauma activation criteria, what we have. So the State Trauma Advisory Board, the STAB, basically breaks up the state into smaller portions, right? Into ATABs, Area Trauma Advisory Boards. The ATAB is who regionally will dictate who decides what they are going to make mandatory criteria versus modified criteria for trauma activation criteria, okay? So locally, the ATAB has broken down into 4 sections, okay? So the first section is physiology stuff, okay?
Could you tell me what ATAB stands for?
Area Trauma Advisory Board.
Thank you.
And then State Trauma Advisory Board is STAB, okay? So you got your physiology. What would physiology be?
What's going on in their body?
Oh.
Yeah, so this is gonna be your ABC stuff, okay? So you have GCS, you have your blood pressure, not blood pressure, respiratory rate, airway management, and let's see, blood pressure, okay? So GCS, they make it so it's, if you have anything 13 or less of a GCS, let's see if I can get this greater than 13 or less of a GCS, it is a mandatory trauma activation criteria. So if you go on a diabetic patient that has a GCS of 13, does that mean it's a mandatory trauma activation?
No, because it was a nature
You
illness.
have to, so that's one of the things that people get hung up on when we start doing scenarios and stuff like that. Like, hey, we got somebody on overdose, they have a stubbed toe, they got some bleeding on their foot. Yeah, we got to do a trauma activation on this. It's like, that's not the idea behind it. The idea is there some sort of mechanism associated that's causing the potential for the GCS? Okay. Respiratory rate. What do you think? Respiratory rate.
10 or below.
Okay, so 10 is the number, the low number,
30.
10 and 30, or 29, so 30. Okay, so respiratory rate, anything below 10, trauma related, above 30. Okay, airway.
Not holding their own airway, I guess.
Anytime
Not-
patient requires airway management.
Yeah.
Okay.
Would that include an OPA or an NPA?
No.
No.
That's just BBM.
Yeah. So basically so let me go back to the OPA, NPA. Remember, you're not paramedics. So if you have an OPA or an NPA on somebody,
You're gonna innovate.
you're gonna be advancing to the next level, right? So I'm gonna say yes, because you should be advancing to the next level.
So
Okay?
if they can't control their own airway, is what you're saying.
Yes, if they have to manage their airway of any way, any sort, then yes, okay? And then the blood pressure, less than 90. Okay, so those are your big physiology portions of it, okay? Anatomy is section 2. I'm a good artist, yes.
Mm-hmm.
With your back turned, I'll say no.
Yes. Yes, indeed. All right, so the way I remember this is I remember it from the top down, okay? So this is one of the common things that we throw out at people, like quizzing them on a daily basis, like, hey, what's your trauma activation criteria? This is the thing that people get hung up on, because there's a ton of them to remember here, okay? So up here at the head, we start at the head, okay? So what kind of things would we consider significant?
ICP.
Obvious Head entry board.
Okay, so what would be assigned trauma-related?
Yeah, pupils.
So think about mechanism, like things that
CSF.
break. So I'm gonna give you a hint. Everything here is external looking trauma. You see stuff.
And it's something penetrating.
What is the standardness?
Okay, so we got penetrating. So we have a penetrating injury.
That's just pertaining to the head.
This is our elbow line. Okay? This is our knee line. Okay? So any penetrating injury to the head, neck, chest, torso, down to the elbow, down to the knees, is a criteria. Also with the head, is a depressed skull fracture. Okay? Does everybody know what a depressed skull fracture is? What it feels like? Has anybody ever felt one? You'd ask Raleigh about his most recent skull fracture that he just had. Somebody fell, hit their head, and got some blood going on. He's like, oh, let me pop
I
it.
had that one.
Wait, did you?
Yeah, he handed it off to me in the hospital.
Yeah, and when he put his finger basically into the guy's brain.
The guy's CT was perfectly fine.
Yeah. So he's palpating, right? It's like, oh, a little bit of soft spot. Whoop. It's like, oh. So like when you palpate the skull, you want to be a little cautious that you're not sticking your fingers into the guy's brain. Okay?
Yeah, 92-year-old male,
92?
fainted and hit his head on the bathtub. He didn't remember the incident. His son heard the crash, and he said their bathroom was covered in blood because of it. But guy was totally fine otherwise, but had no clue what had happened.
All right, so as we move down, so this is basically what we're looking for in the head. Penetrating injury, head, neck, chest, torso, anything to the elbows down to the knees, okay? Next thing we work down, we're gonna come across your chest, okay? Chest wall instability. What kind of chest wall instability
Flail
would
chest.
cause, what?
Flail chest.
Little chest, good. What else?
Sucking chest pain.
Good. What else? How about broken rib?
A single broken rib.
Yeah.
If it's causing pneumothorax.
Okay? So this is where you start to build your case, right? So you have a single broken rib, you're like, I'm okay not doing trauma activation on that. Let's say you got 3 or 4 broken ribs, but it's not a flowed segment. You start building that case a little more, right? You're like,
Significant injury.
okay, there's more mechanism associated to be able to break multiple ribs. You start adding in what the mechanism associated with breaking those ribs were, right? Some of the past medical history, whether or not they're on blood thinners, stuff like that. All right. So we got chest wall instability. All right. And then what do we got here? What are these things?
Long bones. Long bone break.
Long bones, right? We've got 4 long bones in the body. The tib, fib are not long bones. Either the radial or ulnar, okay? Those are not long bones. I get people all the time.
For
Huh?
this criteria.
For this criteria, correct. Long bones are your humerus and your femurs. So we have 4 of them for this, okay? How many have to be broken? 2. 2, right? So any 2 long bones, and it becomes mandatory. So these are the mandatory criteria, okay, that we're going over. Do you have the ability to just say, you know what, this guy's got an open femur fracture, it was associated with something else? Is this can I do a trauma activation on that?
Yeah.
Absolutely, and we'll talk about that at the end. So I just want you to know these are things that take the ability for you to say, I don't really
Black and white.
think we need to. It's like, you know what, we have to. Based on the Area Trauma Advisory Board, STAB, based on that, they've given us rules, it is mandatory criteria that you put them into the trauma system. The trauma system is a statewide, national-wide tracking system for trauma patients, for keeping, data and figures for like, this is where we got our golden hour, our 10-minute scene time, that's where some of this stuff comes from, okay? So all this stuff, anytime it goes into trauma system, it gets reviewed over and over and over and over again by multiple committees, okay? All right, so we got our long bones, what else? What?
Pelvis?
We got our pelvis. What do we want to know about the pelvis?
Stable,
How do we check that?
Pushing it down.
pushing
It
in
is
or
kind of
down.
pushing posterior.
So in, down, since this is pubis, right? 3 staples, okay? Times 3, stability.
So if you find instability in one of those, do you continue to look for instability in the rest?
No. As soon as you have any crepitus whatsoever in the pelvis,
You s-
you stop
We're done.
and you move on.
But you, until you find, if you didn't find one, you do the next?
Yes. So that's why most of the time you start out wide, push down, push in, and then usually the last one, the synthesis pubis. Okay?
What's that one?
So basically, so you run your neck, so basically about that far down, you can feel on yourself, you got like that kind of rigid bone portion, you push right down there, basically it's where the pelvis splits. And so if you get crepitus there, you probably snap the pelvic rings as well, so
And you wouldn't feel that when you
not
when
necessarily.
pushed?
Not necessarily.
So you
It
just
could-
push down on the,
Yes, so you take the palm of your hand, and basically you're pushing up and towards the abdomen. Up and towards the abdomen on that. Okay.
Is that gonna be pain or instability?
Well, if they're unconscious, it's gonna be instability. If they're conscious, they're gonna have pain before you even get to that. As soon as you do these ones, you're gonna have the pain. Okay.